Hi, I'm Dr. Greg Unfried. I'm a staff psychiatrist at Southwestern Behavioral Healthcare, and I'm also medical director of Evansville State Hospital. And I'm going to talk to you today about properly managing the wearing of masks. Now, I have two types of masks to demonstrate today, and just talk a little bit about how you deal with them properly. The first is the sewn mask, cloth mask. You're going to see a lot of these used whenever you're out in stores and stuff. This one was made by my wife. And first and foremost, before you touch any mask, before you put any mask on, you need to wash your hands. Or if you've driven to a store, you need to sanitize your hands. You don't really need to wear the mask while you're in the car. What you need to do is wear the mask whenever you're around other people. So as you see, I have grabbed the mask by the elastic bands here. And with that, I'm going to take it and wrap it around my ears here. And a little bit difficult with the glasses too. And then I'm going to pull it. You see, this is why you need to make sure and sanitize your hands, because you're touching the mask and you don't want the mask to be contaminated at this point. Okay, so now I've made sure it fits around my nose as well as it can and pulled it down to my chin. And so now it's fitting properly. And at this point, it's important to remember not to touch it, because imagine this mask being like the filter on your furnace, where after air has gone through it for a while, it's contaminated. And so you have to assume that now, after I've had this mask on and I've been breathing for a while through it, that it's also contaminated. And the longer you wear it, the more contaminated it's going to get. So whenever you go to a store, go shopping, you've worn one of these, you get back out to your car, you take it off, again, by grabbing the elastic bands like this and taking it off and trying not to touch the mask, because at this point we have to assume it's contaminated. So thinking about that, you don't want to then go ahead and put it in your purse or stick it in your pocket or anything. You want to put this like maybe in a bread bag. I know that's one of the things I've used is a old bag that had bread in it, or a paper bag or something. Put it in that and take it home and wash it before you wear it again. The other kind of mask I have to demonstrate today is one of the famous N95 ones. Now, this one is used by healthcare workers, and for any of you out there that are immunocompromised, this is the only mask that I would recommend you wear if you go out in public. If there's any way possible to get one of these, wear it. If you can't get a hold of these, you're probably safest just to stay at home, because the risk of infection for immunocompromised people is just very high right now. So for this mask, it fits a little different, and I'm going to have to take my glasses off to put it on. Again, grabbing the back of the straps, put it over my head like this, with one strap above and one below my ear. And notice that I also pressed it in right here to make it fit my face quite nicely. Now this mask will prevent you from inhaling the virus. And so this is sort of the gold standard when it comes to protecting yourself. Unfortunately, there's a very short supply of these, so mostly only healthcare workers have them at this point. And again, this one, unlike the cloth mask that I showed you, cannot be cleaned for all practical purposes. And so with this one, whenever you get done wearing it, again, probably best for me to take off my glasses and taking it off by the straps if possible. And then with this one, probably best to store this in a paper bag or something. And, you're going to wear it probably more than once. And so maybe keep it in that paper bag. But again, assume that this part of that mask is going to be contaminated, and this is the only part that you want near your face. a couple of other things to keep in mind when you take off your mask. Most of us are not that used to wearing masks, and so it's like, okay. Unfortunately, what I just did was totally negate the effect of the mask. Before you touch your face, after you've had that mask on, again, you need to wash your hands or sanitize your hands. That's the important thing. It's a way to keep that virus away from your mouth, your nose, which are how most of us get the virus. Anyway, hopefully this is helpful for you, and thank you for listening.